From next week, there will be 3 lectures, 2 theory lectures, and 1 lecture on practical. So we will cover as much as theoretical part of the practical. Demonstration is not possible. We will see once college will open. So for new batch, there is medicine practical of 100 marks, out of which there is 1 long case, 1 short case, and 3 table viva. So long case for 35 marks, short case for 15 marks, then 3 table viva, each for 10 marks, means total 30 marks. 5 marks for your journal, 5 marks for your communication skill, and 10 marks your internal assessment. So that is the pattern of medicine practical. So in long case there is proper history taking of the patient, general examination and systemic examination. And for short case there is only general examination and systemic examination. So there is no history taking for short case, only examination part, and no writing work in exam for short case. But for long case you have to write history and examination points. Then table viva, 10 mark for X-ray, 10 mark for drugs, and 10 mark for instrument. Then journal and communication skill 5 plus 5, and internal assessment 10 marks. So total 100 marks medicine practical. For long case, there are only 2 systems, respiratory system and cardiovascular system. Only 2 systems for long case. For short case, general topics like anemia, jaundice, and core abdomen. Core abdomen case is short case for you. Important is ascites. So first we will start about long case. So in long case you have to take proper history, proper general examination and proper systemic examination, and it is for 35 marks, and your first impression will also in long case, because first there is long case, then there is short case, and then there is table case. So your first impression is always in long case. So you have to prepare long case properly. So for long case, first we will just discuss about history taking. For new batch, so history taking. So it is important to reach to a conclusion about the provisional diagnosis. So proper history taking means asking questions. You have to extract information from the patient so as to make a provisional diagnosis. So from history, you should be able to make a provisional diagnosis about the illness. You should be able to make a provisional diagnosis. So proper history, the skill of history taking is very, very important, and that is our skill. How to take history and how to extract the information from the patient. That is our skill. So at least you should be able to make a provisional diagnosis after history taking and after examination. And then after investigation, it is the final diagnosis. So in history taking, the first include biodata, means person's information. Then chief complaint, history of present illness, history of past illness, personal history, family history, health history, menstrual and obstetric history, patient is female. So about the biodata, you have to take name, age, sex, occupation, religion and address, each one having its own significance. Name, its own significance, age, its own significance, sex, its own significance, because some diseases are particular to a particular age. Some diseases occurs in particular age group. Some diseases common in childhood, some diseases common in young people, some diseases common in old people. So you have to keep in mind at least 1 or 2 examples for each. Which disease is common in childhood, which disease is common in young, and which disease is common in old people. So significance of age, significance of sex. Again, some diseases common in male, some diseases common in female. For example, in female, thyroid disorders, autoimmune disorders are common. In male, liver diseases, ischemic heart disease is common. So like that, you have to keep in mind at least 1 or 2 examples. So that is the significance of sex. So significance of asking name. Name is for identification of the person and for communication purpose. Name is for identification and for communication purpose. Significance of age, significance of sex, significance of occupation, because many diseases are related with occupation. Religion, again, some religious common in Hindu, some religious common in Muslim, some religious common in Christian, like that. So significance of religion and address, because some religions are endemic in some area. So that is the importance of asking address. So for epidemic and endemic purpose, some religions are common in some particular area or epidemic occur in some area. So importance of asking address. So biodata, each one having its own significance. Then chief component of the patient. You have to ask the chief component of the patient. So how to write down chief component of the patient? Patient's chief component should be in patient's own word. Don't use medical word. Don't use medical word. It should be in patient's own word. It should be in chronological order. Means the complaint of longer duration comes first, then next, and then next. So according to duration, the complaint should be in chronological order. So suppose there are 3 to 4 complaints of varying duration. So the first complaint of longer duration comes first, then second, then third, and then fourth. Like that. So according to duration, the chief complaint should be in chronological order in patient's own word. Don't use medical word. They should be of short duration. They should be of short duration. Not since 5 years, 6 years, 10 years, 12 years. Because chief complaint means the complaint for which patient requires hospitalization. Chief complaint means the complaint for which patient requires hospitalization. If the complaints are since 10 years, 12 years, 15 years, then why patient is admitted now? If the complaints are present since 10 years and 15 years, then why the patient is admitted now? Because there is aggravation in the symptoms or increased severity of the disease, or aggravating the symptoms, and for which patient requires hospitalization. So like that, aggravation or increased severity, you have to mention that. So increase in breathlessness, like that, increase in chest pain. Suppose patient complaining of chest pain since 3 to 4 months, but now it is increase in severity, increase in duration, the discomfort is more, and for which purpose patient requires hospitalization. So chief complaint should be of short duration. You have to mention that there is increase in severity or there is aggravation of the symptoms. In patient's own word, chronological order, short duration, with their brief description. Now I will tell later on then how to describe each and every complaint. So there should be a brief description of the complaint, and then chief complaint should be for which patient need to get admitted. Keep in mind, for which patient need to get admitted. Not since 6 months, not 1 year. Why patient is admitted now? You have to mention that. So chief complaint in patient's own word, chronological order, short duration with brief description. Now the history of present illness. History of present illness means you have to describe or you have to elaborate each and every chief complaint in detail. In history of present illness means it is a descriptive. History of present illness is a descriptive. Each complaint is described in detail or elaborated in detail. So for that, your first sentence should be patient is apparently alright. How many days back? That depend on patient's chief complaints duration. So patient is apparently alright some days back. To start with, then take first chief complaint. Describe it in detail. For example, breathlessness. Describe in detail. Fever. Describe in detail. Cough. Describe in detail. Chest pain. Describe in detail. Like that. Each and every chief complaint is described or elaborated in detail in history of present illness. So your first sentence in history of present illness should be patient is apparently alright some days back. To start with, description of one by one complaint. Then after description of one by one chief complaint, you have to take negative history. What is meant by negative history means? Now these are the complaints which told by the patient. The complaints is told by the patient and you describe the complaint. But now, if you think you have to ask some questions, you are not satisfied with the patient's description or with the patient's complaints, or you are not able to reach to any conclusion. If you are not able to reach to any conclusion, or you want to ask some other questions, you want to ask some other questions so as to make a conclusion about the provisional diagnosis. So you have to ask some questions, you have to extract the information from the patient, which patient think that it is not significant, but it is significant, or it is not important. Many times patients think that this complaint is not important or not significant to take it to the doctor. But might be that complaint is very important or very significant. So you have to ask some questions, you have to extract information from the patient, and that is the negative list. You have to ask some question to the patient to extract the information, and that will help you with the diagnosis. That is called negative history. So in history of present illness, patient was apparently alright some days back. He started with description of each and every complaint and then followed by negative history. That is about history of present illness. Then past history. What is past history? Past history means whether patient is suffering from any major illness. Any major illness, keep in mind, it is only the major illness, not minor illness, like cold, typhoid, malaria. These are all minor illnesses. You have to rule out only major illness from the past history. You have to ask past history about the major illness that could be related with the present illness. What is the significance of asking that? Because many times patients' present complaints are related with the past illness, or they are the complications of their past disease. So many times patients treat complaint of the present illnesses related to the past illness. Many times it could be a complication of the past disease. So you have to rule out major illnesses in past history. Which are the major illnesses? Important is ask about hypertension, ask about diabetes, ischemic heart disease, whether patient was suffering from chest pain, whether he consulted with the cardiologist, whether ECG was done at that time, which medication patient started at that time, like that. So history about hypertension, history about diabetes, ischemic heart disease, past history of tuberculosis, past history of bronchial asthma, or past history of COPD. COPD means it is chronic obstructive pulmonary disease. Then any major surgery, only major surgery, not minor surgery. So in past history, no minor illness like typhoid, malaria, cough, cold, this is last. Only these major illness: hypertension, diabetes, ischemic heart disease, tuberculosis, COPD, asthma, and any major surgery. So these diseases should be ruled out in past history, or you have to ask to the patient whether patient is suffering from these diseases. So that is about past history and significance of asking past history. Now the personal history. Personal history important is addiction or the habits, because addiction habit cause many diseases or many illness with all of you know. So important asking about habits: smoking, tobacco chewing, alcohol. That is important. So you should know the diseases because of smoking, diseases because of tobacco chewing, and diseases because of alcohol consumption. Alcohol consumption mainly causing liver diseases like liver cirrhosis, jaundice. Then alcohol also can cause ischemic heart disease, or alcohol is also can cause cancers of gastrointestinal tract. So diseases because of alcohol consumption, diseases because of tobacco chewing, and diseases because of smoking. So smoking is mainly responsible for lung cancer and COPD. Smoking is responsible mainly for COPD, chronic obstructive pulmonary disease, and lung cancer. Then smoking is also responsible for ischemic heart disease or myocardial infarction. Or smoking is the major cause of myocardial infarction in young people. Myocardial infarction means heart attack. So smoking is the main cause of heart attack in young age. So smoking causes lung cancer, ischemic heart disease, and COPD. So you should know the disease related to the smoking. So that is the importance of asking habits. That is the importance of asking habits. So disease related with smoking, disease related with tobacco chewing. Again, tobacco contains nicotine. So tobacco chewing is again a risk factor for ischemic heart disease, for CVA, that is cerebrovascular accident, or many cancers. All of you know. So smoking, tobacco chewing, alcohol. That is the important habits to ask the patient. Then about the appetite and about the sleep. Whether sleep is good or disturbed, whether appetite is good or poor. Then any urinary and bowel complaints. No problem with passing urine or problem with defecation. Any constipation, diarrhea, etc. or burning micturition, hematuria, etc. So urinary and bowel complaints. So this point should be asked in personal history. Habits, appetite, sleep, urinary and bowel complaints in personal history. Then family history. Family history is to rule out hereditary diseases which run in families. Hypertension, diabetes, these are the diseases which run in families. So family history is to rule out hereditary diseases. Whether parents are suffering from the same disease or not. Even asthma is having family history. Then drug history. About drug history, whether patient is taking any regular medication for some diseases, for some major illness. Any regular medication patient is taking for other illness like antihypertensive drug, anti-diabetic drug, drug for ischemic heart disease, etc. So whether patient is taking any regular medication for other illness, you have to ask about the drug history. Whether patient is taking any regular medicine. So you have to just don't ask but also see the drugs and mention it. Which drugs patient is taking. Drug for asthma, drug for COPD, drug for hypertension, drugs for diabetes, drugs for ischemic heart disease, anything. So any regular medication patient is taking for other illness. And then whether patient having any allergy to any drug. The patient having allergy to any drug. That is also important before prescribing any drug. Allergy to any drug. So that is about the drug history. Then if patient is female, young female, particularly you have to ask menstrual history. If patient is an old lady, you have to ask history about menopause. How many years back there is menopause. Then whether there is history of any surgery like hysterectomy means removal of uterus, you have to ask about that also. So about menstrual history, you have to ask whether the cycles are regular, whether the flow is heavy or normal, means whether there is menorrhagia, excessive bleeding, and the last menstrual date. If patient is young, you have to ask last menstrual date to rule out pregnancy also, possibility of pregnancy. So last menstrual date in young patient should be asked to rule out possibility of pregnancy because we have to describe the drugs which can be hazardous to the patient. So before prescribing any drug in young female, always rule out the possibility of pregnancy and then describe the drugs because many times many drugs are contraindicated in pregnancy. So in menstrual period, whether cycles are regular, whether flow is normal or heavy, whether there is history of dysmenorrhea and menorrhagia, and the last menstrual date. In obstetric history, number of children, whether the deliveries are normal, vaginal deliveries or by cesarean section, then any complication occurring during pregnancy, during delivery, whether history of family planning operation or history of hysterectomy. So all that you have to ask in obstetric history. Number of children, normal or LSCS, any complication, history of family planning operation or hysterectomy. If patient is old female, ask about the menopause. So menstrual history, obstetric history in female patient is very very important. Don't forget. So that is all about the history taking. Biodata of the patient. Just give me the history taking. Biodata. Chief complaint. History of present illness. History of past illness. Personal history, family history, drug history, menstrual and obstetric history. So in biodata, name, age, sex, occupation, religion, and address. Having each one having its own significance. Each one having its own significance. For name, identification and communication purpose. Age, some diseases common in children, some diseases common in young, some diseases common in old people. So many cancers common in children, many cancers common in young and many cancers common in old age. In old age, usually the diseases are mainly osteoporosis, arthritis. These are the diseases common in old people. Then in children, leukemia is common in children. Lymphoma is common in young age, like that. So significance of age, significance of sex, thyroid disorder, autoimmune disorders common in females, ischemic heart disease, liver disease common in males. About occupation, there are many diseases which are occupation related. For example, healthcare workers always are at high risk of acquiring infection. Then workers or the technicians in X-ray department or in radiology department, they are always at risk of leukemia because X-ray exposure causes leukemia, like that. Then who are working in mines, who are working in construction, they are always at risk of developing lung diseases. So many diseases are occupation related. So importance of asking occupation, then religion, some diseases common in Hindu, some diseases common in Muslim. So usually in Muslim females, vitamin D deficiency is common because of their Gurukha tradition. They are not exposed to sunlight. So vitamin D deficiency is very common in Muslim females, and the risk of osteoporosis also. The megaloblastic anemia is common in Hindu because they are on strict vegetarian diet. So like that, megaloblastic anemia common in Hindu because of strict vegetarian diet. So that is the example of asking religion. Then address. Some diseases are endemic in some area. That is the importance of asking address. Chief complaint, patient's own work, chronological order, short duration, grid district. So you have only two systems for long case. One is respiratory system and one is cardiovascular system. Then there are selected cases for respiratory system and for cardiovascular system also. So your chief complaint of the patient are related only with these two systems. You are having only two systems for long case. So your patient chief complaint are also related with these two systems. For respiratory system means diseases of lung. Respiratory system is diseases of lung. So patient chief complaints are breathlessness, cough and fever. These are the chief complaints related with the respiratory system. Fever, cough and breathlessness, and sometimes non-specific. For cardiovascular system, the chief complaint is again chest pain, then breathlessness. Sometimes palpitation and symptom. Symptom means giddiness, palpitation is awareness of our own heartbeat. So for cardiovascular system, the chief complaints are chest pain, breathlessness, palpitation and symptom. So you have to describe these complaints. Now how to describe these complaints we will discuss one by one. So what is chronological order? If patient is having fever, cough and breathlessness. Suppose initially patient having fever since 10 to 15 days. Then patient start coughing, cough since 7 to 8 days. Then patient start breathlessness. So that is since 2 to 3 days. So like that, fever since 10 to 15 days, cough since 8 to 10 days, and breathlessness since 2 to 3 days. Like that. That is the chronological order. So fever, cough, breathlessness in chronological order. Now, brief description of each complaint. Now, how to describe this complaint? So, your common complaints are about the two systems, fever, cough, breathlessness, chest pain. So, you have to describe or how to describe or how to take a brief description of each complaint. One by one we will discuss. So, first complaint, fever. That is the common complaint in respiratory system, fever. About fever, what questions you have to ask? First, duration of fever, since how many days? Then the grade of fever, whether it is very high grade fever, moderate grade, low grade. Then whether fever is continuous or intermittent. Then whether fever is associated with chills and rigors. Then whether fever is more in the evening. Fever is more in the evening. That is called as evening rise of fever. That is also having its own significance. So about fever, grade of fever, high grade, low grade, moderate grade, associated with chills or rigor or not. whether intermittent or continuous, and history of evening rise of fever means whether fever is more in the evening and night. Fever is more in the evening and night and associated with profuse sweating at night, that is called night sweat. Profuse sweating at night, that is called night sweat. So fever with chills and rigor, duration of fever, grade of fever, intermittent or continuous, and evening rise of fever. So these are the points on how to describe a fever. So patient having fever since 10 to 15 days, high grade, not associated with chills and rigors, it is continuous fever or it is intermittent fever and there is no history of evening rise of fever. Like that you have to describe fever. So fever is a chief complaint mainly associated with respiratory system. Mainly associated with respiratory system. Fever in cardiovascular system is rare. Then about next complaint, that is cough. So about cough, which points you have to ask whether cough is dry or coughing expectoration. So expectoration, you have to ask about expectoration whether it is sticky, mucoid, white, whether it is yellow color or whether it is greenish color. So whether cough is dry or with expectoration means productive cough. Whether cough is dry or productive cough. Productive cough means with expectoration. Then color of expectoration, whether it is sticky, white, mucoid, that is seen in asthma patient and COPD patient. Thick, sticky and mucoid mucus expectoration. Then whether the color is yellow or greenish. Yellow greenish color usually suggests of infection, that is seen in bronchitis or in pneumonia. So color of the expectoration, and then important point about cough is history of hemolysis. History of hemolysis means whether there is presence of blood in the sputum. Presence of blood in the sputum is called hemolysis. Hemolysis spelling is HAEMOPTYSIS. That is hemolysis. Blood in the sputum. So about cough, dry, expectoration, color of expectoration, and history of hemolysis. That is important. History of hemolysis. Blood in the sputum is called hemolysis. So description of fever, description of cough. Now description of breathlessness. About breathlessness, first duration. Since how many days patient is suffering from breathlessness. Then progression of breathlessness, whether it is gradually progressing. Breathlessness is gradually progressing over days, over months, like that. So duration of breathlessness, progression of the breathlessness, then grades of breathlessness. So what is grades of breathlessness? It is grade of breathlessness. So breathlessness is 10 to 15 days, gradually progressing, or whether it is sudden onset. Sometimes breathlessness is sudden onset, like in heart failure, in left ventricular failure. Breathlessness is a sudden onset. In pulmonary embolism, breathlessness is sudden onset. So whether it is sudden onset or it is gradually progressing over days. Then grade of breathlessness, there are 4 grades of breathlessness. Which are these grades? Grade 1 or breathlessness, that is patient feel breathless. Patient feel breathless on heavy exercise. Patient feel breathless on heavy exercise or it is also called as unaccustomed exercise. Breathlessness on unaccustomed exercise or heavy exercise means even healthy people, even normal healthy people also become breathless at that level of exercise. Means suppose climbing 3 to 4 floors, climbing 4 floors, or climbing hundreds of steps, then even normal healthy people feel breathless after second floor or third floor. So that is grade 1 breathlessness. That is grade 1 breathlessness on heavy exercise or on unaccustomed exercise means even healthy normal people also feel breathless at that level. So that is grade 1. Grade 2 breathlessness on accustomed exercise. Accustomed exercise means the level of exercise which healthy people can tolerate. Means we can climb 2 floors, 3 floors without feeling breathless. We climb 2, 3 floors without feeling breathless. Healthy or normal people. So grade 2 is the breathlessness on accustomed exercise. Accustomed exercise means the level of exercise which normal healthy people can tolerate. 2 floors we can easily climb without feeling breathless. But if any patient feels breathless after 1 to 2 floors, that means it is grade 2 breathlessness. It is grade 2 breathlessness. Grade 1 on custom exercise, grade 2 on accustomed exercise, grade 3 on routine daily activities. On routine daily activities. Routine daily activities, going to bathroom, washroom, like that, going to toilet. So indoor activities. Patient feel breathless in indoor activities or routine activities. Just walking through distance like that. That is grade 3. Grade 4 is breathlessness at rest. Patient is breathless even in sitting position, in lying down position. That is grade 4 breathlessness. So there are 4 grades of breathlessness on unaccustomed exercise, accustomed exercise, on daily routine activities or indoor activities, and at rest. These are the 4 grades of breathlessness. So the remaining part we will discuss in next week. So there will be 3 lectures from next week, 2 theory lecture and 1 on practical. So as much as theory part of the practical we will cover.